Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about what is medical billing and what is medical coding. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so I got a direct message on Instagram and I'm gonna read it because I think this question can apply to some folks who are newly doing their research about medical coding, or maybe they just started a medical billing and coding program and they kind of want to know what they got themselves into. So here we go. All right, so the viewer says, hello, I have found you on YouTube and I have a quick question. I am an LVN that just started a medical billing and coding course today. Is this the way to become a coder? Is medical billing and coder the same as just being a coder? I'm just a bit confused. Okay, so here's the thing. You need to know first what each is. So what is a medical biller and what is a medical coder? Sometimes these individuals are two different people and sometimes it is the same person. So a medical biller is just as the name states, they do the billing. So they are the ones that work with the insurance company. They are the ones that collect the money from the patient. They are the ones who submit the claims. Oftentimes medical billers will receive documents like anything from like a Q format or whatever, and they have all of the information on the patient, their insurance, the diagnosis, the procedures that happened during the visit, and then they submit it to the insurance company. They take care of all of the financial side. That is what medical billers do. So you don't have to be certified to be a medical biller, and all of the certification exams, the four main ones, the CCS, the gold standard of medical coding credentials, the CCA, the CCSP, or the CPC, all test on reimbursement on all these four exams. So that's something that you need to know. Even though medical coders do something separate, which medical coders take care of the coding side. Now, I have only done coding in my career. I have never done billing. However, the codes that I select have gone to the biller so the biller can submit it on to the insurance company and everybody's happy when they get paid. But I don't actively work with insurance. I don't do any of that prior authorizations. I don't do any of that, calling them up to verify the insurance. I don't do that. As a medical coder, you are looking at documentation, you're abstracting, which means that you're selecting codes out of whatever is documented. So we always code based on documentation as medical coders. So that's what a medical coder does. They are the ones who query the providers. They work with the staff. They also work with the provider on documentation practices, and maybe answering questions about, documentation and things. So that's what coders do. So medical billers and medical coders are like cousins, okay? We all have the same family, right, in healthcare. But medical billers have a particular task and medical coders have a particular task. So the medical coders work with the doctors, the medical billers work with the insurance side, okay? Now, sometimes it is the same person who does both the coding and the billing, depending on the size of the doctor's office, okay? Sometimes a doctor will hire somebody to take care of the billing and coding for them. So they'll just document and they'll work with a single person, to take care of that billing stuff and the coding stuff. And in smaller practices, that works, right? Because the doctor is typically doing a lot of the same procedures. So the coder gets very familiar and they have to make sure that everything is selected appropriately. And so that's how that happens. So a lot of times you'll hear, this is my medical biller coder. Okay, and because basically they're saying that this person bills the insurance company for all the procedures and diagnoses, and they also do the actual coding itself. So that's why they call them that way. And you'll see programs called medical coding program, medical billing and coding. But rest assured, we are all tested on reimbursement, and that is the billing side of the house. This is when they're talking about RVUs, APCs, DRGs, that's all of that stuff. And so that's talking about prior authorizations, that's talking about Medicare, Medicaid billing and that kind of thing. So it's always going to be part of the medical coding programs. I've gotten the question before of, well, Blue, I don't want to do billing. I just want to do coding. Can I just skip the billing stuff? No, you may not. Because when it comes to anything that you're learning in this program, these programs are generally kind of the same. Some have a little bit more things to them, like different topics and stuff. But for the most part, the core of most medical coding programs is the same. So reimbursement is always going to be a part of that. And yes, you do need to know this. Even though, like I said, I don't do billing, but I do know that there are certain caps to the amount that can be billed on certain insurances for certain procedures, right? Typically, if you've done anything in allergy clinic, you know what I'm talking about. It will only max out to a certain amount of units based on the insurance that that individual carries. So that's something that you need to be aware of. Even though you don't do the billing, you may not actively do billing, you still need to be aware. Because on the billing side, because you don't need to be certified, and this can be backed up, you can verify this by looking at the job listings for medical billers. When you look at the job listing for medical billers, sometimes they're asking for the individual to have experience. They say preferred. Preferred does not mean required. And they say they want a high school diploma or a GED. I have never seen them ask for a medical billing credential. Now, do not comment and say, oh no, I saw that. Okay, guys, listen to what I'm telling you. I look at these listings all the time. I have yet to see them asking for a billing certification, okay? So a lot of the things you will learn on the job. Yes, it is good to have a medical coding background or a medical coding training, because this means you're going to understand when you see a claim getting rejected because the appropriate modifier wasn't applied, or the appropriate procedure wasn't applied, or maybe the diagnosis and that procedure don't go together, right? You're going to be able to spot that, because as a trained medical coder, or having that education in coding, you're going to know why this kicked back. Because medical billers don't have to have this formal training, a lot of them just like, oh, okay, well, it got denied because there was a modifier. I don't know which one, so okay, we're just going to do a write-off. And I hear that a lot. So it's very important to educate yourself, because even though they're not asking for that experience, or they're not asking for that training for billing, it doesn't mean that you have to be like, oh, okay, yeah, I'm not going to do my research. I'm not going to try to figure this out. Because the more successful billers are the ones who do the investigative work, just like a medical coder would. Because again, you're using encoder software, a lot of times billing software, and sometimes they have those things built in where it'll recognize if there's something that's off, but it's not going to catch everything. So again, that's why it's important to have clean claims when you are a biller, to come to you, so that way you can send them out. I was going to say ship them out, like ship, but it's not that way. Okay. So sometimes you have to be the investigator as well. So just make sure that you realize that when you are doing these things as a biller. I always recommend that if you are going to start your career in medical coding, and you can't get a job in medical coding, that you can always start in billing. A lot of medical coders start in billing. And billing is a great way to kind of like work your way in, and it's not the same kind of pressure as a new medical coder would get, because remember, for a new medical coder, the pressure is accuracy and productivity. Those are the two big things with coding. And for some people, they kind of want to ease their way in. Medical billing is a great place to start. It does require you to kind of understand and know what's going on and understand the billing processes. And again, because different facilities take different insurances, it's going to be okay for you to get training on the job for those types of things. But again, if you are going into medical coding, they are going to train you on how to use the electronic medical record. They will not train you on how to code. If you have a question, that's something different. But a lot of people have that misconception of, I'm brand new, I'm entry level, so I need to be trained. No. In coding, they're going to want you to know how to do your own research, so that way you can be in there. You can still ask questions, but they want to make sure that you know how to do your own research. And if you don't understand something, you need to speak up, or you need to find somebody who can tutor you so that you can understand. Okay, that is very important to coders. Okay, so whenever you see the name of a program, this is a medical billing and coding program. You can be trained in a medical billing and coding program and be a medical biller, or be just a medical coder and not have anything to do with billing, and vice versa. Be a medical biller and not have anything to do with coding. So it's just the name. It's just what we fall under, because we fall under the broader umbrella of health information management, right? Even though we are not like managers, like supervisors, but we do manage this health information, and we look at this documentation, we select the appropriate diagnosis code, the appropriate procedure codes, and that's what we do as medical coders. So don't get confused with that, because it's really easy when you're looking at what it is you're being trained on. Because typically when you start these programs, they're going to give you a syllabus of everything that you're going to learn. When I went to medical coding school, that's what I was given, a whole list. And I was like, wow, I have to know anatomy and pathophysiology and all of that good stuff. Yes, because you have to read medical documentation. We have to know what doctors know while never having gone to medical school. There is no truer saying than that. So that's what you got to know there. And the other thing that I wanted to say was, if you are doing the medical coding and you think that you need to add on additional credentials like the CPB and all this other good stuff, all the other billing credentials, you don't need them. You can go through the course, but you certainly don't have to sit for the certification. Oh, well, I want the certification. When no one is asking for it, guys, it's more money that you have to put out. Every single credential, and I want you guys to listen to me when I say this, every single additional credential that you add on is going to up the amount of CEUs, or continuing education units, that you have to complete in your 2-year time period for reporting. Okay, both AHIMA, the American Health Information Management Association, and the American Academy of Professional Coders, AAPC, both of them have a 2-year reporting period. So you have a set number based on the number of credentials you have of continuing education units that you must complete during this time. So again, all the additional credentials that are not going to get you more money, that are not going to get you hired faster, it's going to add up. And this is a very expensive field. And I just want you guys to know that I've done the cost analysis before, and I probably need to do it again. But this is a very expensive field. You don't need to have to put out all this money trying to get in. The way that you're going to be able to get in is to be very knowledgeable. That is above all else that you have to be knowledgeable. Everybody's going to ask for experience before any of you says anything. Everybody asks for experience. But it doesn't mean that they don't hire brand new people, because they do all the time. That is how all of us got our start. The ones that have experience and the ones that are veterans, this is how we got our experience, by being diligent and being out there and applying. Okay, so again, you can go through the program if you insist on being trained to learn billing individually, separately. That's entirely up to you. But again, it's just going to augment your learning. I mean, it's not going to get you more money if you think getting the CPB will do all that. Okay, so that's just my advice to you guys anyway. There's going to be a lot of things that you are going to hear as a student, that you need to do this, you need to do that. I've heard many schools try to push more credentials. All you need is one. And any of the 4 main ones, the CCS, CCA, CCSP, or the CPC, they all test on a wide range of topics. So billing and reimbursements all covered on all 4 of them. All right. All of the specialty services, it's reported. I mean, it's tested on all of them. Auditing, again, in some form or some way, is all tested on all of them. All right. Diagnosis coding is on all of them. Procedure coding, again, on all of them. The CCS and the CCA cover both inpatient and outpatient coding. So that's what you have to know for those. The CCSP and the CPC only cover the outpatient side, and that's totally fine. It's depending on where you want to work, all right? Or wherever you get a job. But yes, so take one step at a time. And usually in your program, they'll tell you, this was the thing I was trying to remember. In your program, they will tell you what their program is training you for, which certification you can sit for. It needs to be the CCS, the CCA, the CCSP, or the CPC. Any 4 of those that they're training you for, that you have the option to be able to sit for after you complete that program, that's good. If it is not one of these, CCS, CCA, CCSP, or the CPC, you do not want that program. And they're typically like 2-month programs. Those ones that they're not even, I don't even know what they're thinking when they put those programs out there, because they say, oh yeah, we can train you to be a medical biller coder in 2 months. No, don't even do it. Don't do it. Because if you do it, then you need to have a lot of other training, and you need to be studying a lot more on your own, because there's no way you can cram everything that you need to know about being a brand new medical coder in just 2 months. I don't care if you have a medical background or not, because a lot of people will tell me, well, Blue, I'm a nurse. It's still, you, even with nursing, my LVNs, LPNs, RNs, CNAs, all of you all, yes, you have a great background in anatomy, pathophysiology, and physiology. You get it all, right? And that's good. That's a good basis to start, because that is very important for us to know. However, getting into the coding, you know, when you get into it, you'll see what I mean. It is completely different. The mindset of a medical coder is completely different. And a lot of people say, well, Blue, I just don't get it. It is so much information that you all have to know. Yes, it is. And it starts with knowing your coding guidelines, which is why I always harp on y'all to read the coding guidelines once per week. Now, for some of you all, you say, Blue, that's too overwhelming. That's too much information. And it may be, and you may not understand it right away, but it's not going to make sense until you get into the real world and you start applying it. It's going to make sense when you're being tested and all of a sudden you see a question on there that, if you recall your guidelines, it's a lot faster than having to go through the book. Okay? And you're like, oh yeah, I recall which way that has to go because I've been reading my coding guidelines. Not only that, you get to be a faster reader, which reading quickly and reading comprehension is key to our field, because if you don't have those things, it's going to be very difficult for you. Everybody has production standards. Everybody has accuracy standards at their facilities or doctor's offices. There's a level of that expectation when you get in. So start working on it now. Read those coding guidelines and get into a program that is training you for the CCS, CCA, CCSP, or the CPC. Any 4 of those. And if it is not, that is not the program that you want. If it is, and you're in that program and you've already paid your money, there's nothing else that you can do, you can augment your studies by looking at the independent study video link that I put in the description box. The information is free, guys. All of the books are there that you need to study on your own, okay? You don't have to go through a formal program to sit for any of those 4 credentials, and you only need 1. You don't have to go through a formal program. You can study independently. When you feel you're ready, then you can go ahead and sit for the exam. And of course, pay your fees for sitting for the exam. But a lot of people do the independent study, but you have to be very disciplined. And there's a lot of people who want to start that way, and then they just feel like they can't because they don't feel like they have some kind of accountability. If you guys, I have 4 night-a-week shows. You can always use my show times as accountability time. What did you do today? You can always comment it in the comments. Hey, Blue, I read the coding guidelines. Hey, Blue, I worked in the workbook that you recommended that's in the description box below. Hey, Blue, I read this on CMS. Hey, Blue, I read, the E&M guidelines. Anything. Okay, guys? Use this use my channel as a what is it? Accountability. Check in and leave a comment. Tell me that you're working. And if you don't want to say anything, you can always leave a blue heart. Okay, that'll tell me, hey, this person is working on their medical coding studies and they're using this time. Okay, start looking for ways to get creative. All right. So hopefully that answers your question. And thank you guys so much. If you haven't had a chance to already, I hope that you like, subscribe, and share. And I'll see y'all next time. Bye.